single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. Every year, roughly 1,700 people die from suicide in New York State. Given that harsh reality, the Office of Mental Health has focused on sharing resources to support New Yorkers battling depression and anxiety. During Suicide Prevention Month in September, that meant focusing largely on the 988 crisis line. Recently, Governor Kathy Hochul signed legislation to have the number printed on student ID cards on college campuses across the state. Hochul, along with the office, also launched a campaign to bring awareness to the line on social media and streaming services. For more information on those efforts and the work being done beyond Suicide Prevention Month, we sat down with Dr. Ann Sullivan, Commissioner with the New York State Office of Mental Health. Here's that conversation. Thank you so much for joining us today, Commissioner.
Oh, it's a real pleasure to be here. Thank you so much for asking.
Of course. Now, at the time that we're filming this, we're, of course, at the tail end of Suicide Prevention Month. So can you help us understand the work that the office has been doing to bring awareness and resources to New Yorkers who may be battling thoughts of suicide?
Yeah, the agency has been doing a tremendous amount. Under Governor Hochul's guidance, we have put a major emphasis on trying to prevent suicide. And preventing suicide, the biggest issue is to let people know that there is help available. So help available, the first thing I want to mention is 988, which is a simple 3-digit number, which we are expanding all across the state. We're doing a major campaign that anyone can call 24/7, and you get to talk to a trained counselor. So being able to just access that is critical. For example, the governor signed into a law that colleges will put the 988 number on their IDs for students. So it's always there, always available. So the first is to get out to the community, the awareness that help is there. And then there's lots of specialized programs that we're also working with, particularly with our youth in schools. So for example, we're going to be expanding across the state something called Teen Mental Health First Aid. When the governor did listening sessions with youth all across the state, one of the things the teens said they needed help with was that when a teen was feeling upset, emotional, or having thoughts of suicide, one of the first things they went to were each other, to peers, those who they talked to. So Teen Mental Health First Aid helps teens know how to talk to teens about mental health issues. So that's something that we're going to be expanding in schools, including also an expansion of our school-based mental health clinics. Any school that wants a mental health clinic can now have one. And what does that mean? That means that there is staff on site, which is something else that the youth asked for when we spoke to them across the state. Someone trusted that they can talk to. So expanding our work with youth is critical. And then there are special programs for youth that are particularly at high risk. So Latina adolescents, when you look at the numbers of youth who are coming into emergency rooms with suicidal ideation, Latina adolescents, especially girls, are coming in at a very high rate with suicidal ideation. So we have a great program which has been developed called Life is Precious. And Life is Precious is a program that works specifically with teens, Latina teens who have suicidal ideation or maybe have made suicide attempts, and works with them. They have a therapist, they go to a clinic, but they also works with them in the programming about art, music, getting involved in community, working with their families. And Life is Precious began in New York City, but we have now expanded it to Poughkeepsie, Yonkers, and a new one up in Amsterdam that will be starting soon. So there's suicide prevention involves a whole community. It involves specific work with specific groups, also just letting community know that help is there. So there's a lot of work that we're doing to get the word out across the state.
And as you mentioned, the office has been pushing the 988 crisis line. So I'm curious, did you see an uptick of usage of the line during Suicide Prevention Month?
We've seen a gradual increase on an ongoing basis, actually, since July of 2022, when the 988 number became live. We've had about over 500,000 calls from New York State to the crisis line. And every month it goes up. Every month it goes up. I don't know yet if this month we're going to see a kind of a bigger jump than usual, but there's been a curve that has continued to show people getting aware that the number is there and that they can call, which is terrific because we want everyone who needs help. And it's available, obviously, if you're in a crisis and feeling suicidal or having suicidal ideas, but it's there for any kind of mental health question as well. So a mom who maybe is concerned about their youth just not going to school or not wanting to go to school and they're not sure how to deal, they can call. You can call about a neighbor or a friend. You can call just because you've had a crisis at work and you really feel like you don't know how to handle it and you want to call. So 988 is really there for the whole range of issues that affect our mental health.
And as you mentioned, the governor recently signed legislation requiring colleges across the state to print that number on student ID cards. So can you tell us more about the impact of the legislation on the work that your office is currently doing?
Yeah, I think we'll see that soon to come out to the colleges. But we've been working with the colleges for a while on suicide prevention, on mental health first aid training for the college staff, for faculty, for resident assistants, for the people who work with students in the colleges. So mental health first aid is a great way for someone who works with youth to know how to talk to youth about issues like emotional problems, issues like suicidal thoughts, issues like depression. So we've been doing that work with colleges. We also have a handbook for colleges. We've been connecting colleges to community-based services. And so adding the 988 on the ID card means it's kind of ever present there for someone to see, easy to think about if you're having a bad moment and you can look at it and you can say, maybe I'll call. So I think that's been great to be able to get the word out, and it's kind of a little more personal for each individual student.
Right. And when it comes to mental health, there seems to also be an access issue in which different insurers may not cover mental health related services. So what are some of the other free or lower cost resources that New Yorkers can access if they're experiencing depression and anxiety?
Well, first of all, if you call 988, they will tell you, and you can, if you say to them, for example, that I don't have insurance, they will help you to go to a place where we have basically care that for everyone. So our certified community behavioral health centers, our clinics, they are all open. They all have subsidies from the government for individuals who don't have insurance and can't pay. So any one of our certified community behavioral health centers, any one of our clinics, all that is available for someone to come in. I also want to emphasize, though, that we have been working very closely, the government has been working very closely with insurers to ensure that insurers pay. Most people who have insurance of some sort, whether it's Medicaid or commercial, should be able to access mental health care. And if you're not, and there's some difficulties, then you need to call something which we have in the state called CHAMP, which is a CHAMP. And CHAMP will help you access those through your insurer. So, for example, school-based mental health services now have to be paid for by every insurer in the state. There was legislation that said that had to happen. Our crisis services, as of 2025, every insurer in the state will have to pay for those. So your insurance, one of the things which the governor has also done is made sure that the insurance company is more robust in its coverage for mental health and ensuring that mental health services are available. But all our services within the mental health system, all our clinics, et cetera, you can walk in and get services. And even if you can't afford, you will be able to get the services.
And what are some of the learnings in this year's Suicide Prevention Month that you're hoping to expand on or hone in on in the years to come?
Well, going forward, I think what's so important is that we get everyone to realize that if you have an emotional problem, if you're depressed, if you're anxious, if even suicide is just kind of crossing your mind because you're feeling so hopeless or overwhelmed, that you should ask for help. You know, if you fell down and you hurt your arm and it started to swell and you got really concerned, you would have no hesitation to go to a doctor or an emergency room and say, hey, there's something wrong with my arm. Well, when something is affecting us emotionally, when it's affecting us, our mental health, as same as physical health, we should feel just as comfortable going for help. That's the biggest protector of suicide, is people asking for help early and getting the help that they need. So we really have to change our culture, which is changing. It's happening, that mental health and physical health are just as important. And that, in fact, there was a Surgeon General who clearly once said, there is no health without mental health. You can't be healthy without mental wellness as well. So as we move towards more mental wellness, just have people realize that if you're in a tough spot, if you're feeling overwhelmed, if you're feeling somewhat hopeless, talk to someone, get the help. It's just as important as if you had a serious cold and you went to the doctor, or the flu, or you broke your arm, you would go to see someone. Same thing for mental health.
And the time that we're currently in is, of course, extremely political. With just a few weeks ahead of Election Day, there has been a lot of conversation around extreme rhetoric and how that might incite political violence. So is there anything that the office is doing to help New Yorkers who may be feeling overwhelmed during this election cycle?
You know, I think it's important to remember that there are always events going on around us that can be overwhelming. And certainly one of the things that we are going to be doing with the governor as well is just telling people that one of the ways you can deal with feeling overwhelmed is to take some action. And what's the best action that you might be able to take is to get out there and vote. If you're worried about the election, then vote. Be part of the solution, be part of getting your voice heard. So I know that there's a campaign on the part of New York State to get everybody out there to vote and have their voice heard, because that's one of the things that can help relieve anxiety, that you're a part of doing things. The other thing is, I think, depending upon the individual, sometimes that anxiety comes from a personal place. And then if that's another reason, you could call 988 and talk to a counselor and say, I'm really worried about the election. And often, sometimes those worries are very personal to an individual, and having someone to talk to about it can be very, very helpful. And that's another reason you can call 988. You don't have to hesitate, is my point. So I think we're here to say that whenever things in society are also affecting you, feel free to reach out and talk about them. The worst thing in some ways is to keep them all inside and to yourself, because then it's not as effective as talking it out and really being able to express what's going on.
And as you mentioned earlier, your office has also been pushing for there to be a mental health clinic in every school in the state. So can you tell us more about the progress that's been made on that front?
Well, I think we have over 1,200, getting close to 1,300 mental health clinics in the schools. And I've just met recently with a number of the school superintendents, et cetera, the organizations, to get the word out. And so we're having people come. It's a rolling application. You don't have to apply at a particular time. We have been talking to all the districts to please talk with us. We will help facilitate, work with you to find a provider, if you don't know one, who can come and do the work in the schools. So we really are hoping to add hundreds of new school-based clinics each year, especially in the high schools and middle schools.
And lastly, what will be your priorities heading into the next year? How do you plan to get additional state funding, and what will likely be an intense budget season?
Well, this governor has been incredibly supportive of mental health. I mean, the $1 billion budget, we have now placed out all of the RFPs. All that money's on the outside. We've been awarded 2/3 of, 3/4 of it have been awarded. But the money's all out there in RFPs. That was $1 billion. And then in the last budget, I would say it was probably about 500 million that came in various ways to help mental health. So I think that we are in the process now of seeing the fruits of that. It takes a while for those services to come up and to be available. And we're looking at ways of where there might still be some gaps in terms of services. And we're always working with that. But I can't thank this governor enough for an investment that's been historic in mental health over the past 2 years. And I believe will really transform the system, all the way from all the prevention things I'm talking about with school-based clinics and working with teens, to community mental health centers that have been tripled our certified community behavioral health centers to the intensive services for individuals who may need a hospital bed or individuals who may need help because they're living on the streets. Dollars that have been spent across the system. So we've had a lot of investment. I think we're looking at where we may still need some more, but we'll be making our case to the budget, but there's lots of needs. So, that will ultimately be made. Those decisions will be made by the governor and the legislature.
Well, unfortunately, that's all the time we have for now. Thank you so much for taking the time to connect with us today, Commissioner.
Thank you so much for having me, and please spread the word about 988. Please let everyone know that help is available with 3 simple text or phone, 3 simple numbers, 3 simple numbers.
And we were speaking with Dr. Ann Sullivan, Commissioner of the New York State Office of Mental Health. And for more information on the work of the office and the 988 crisis line, you can visit our website. That's at nynow.org. Now turning to another important topic. Some counties across the state, including Nassau County and Ballston Spa, are implementing mask bans over what they say are public safety concerns. Meanwhile, the New York Civil Liberties Union is actively condemning the local laws. The union is arguing that the bans will impede on the rights of New Yorkers. We sat down with Beth Haroules, senior staff attorney with the union, to understand more. Thank you so much for joining us today, Beth.
Great. Thank you for having me.
Now, as we know, both Nassau County and Ballston Spa in New York have announced laws prohibiting mask wearing across the state. So can you unpack the Civil Liberties Union's current position on the bans?
Sure. So Ballston Spa is a little bit easier to address. They actually enacted their mask ban literally days before Nassau County enacted theirs. They are different in terms of phraseology, but Ballston Spa's mask ban is based on a Glens Falls mask ban statute, and it falls inside of a parade permitting scheme. So basically, Ballston Spa wants any person who wants to engage in a parade, which includes protest, to get a permit. And as part of the permitting process, there's a ban on any face coverings, which also include gas masks. So interestingly, we believe that Ballston Spa is reacting to Proud Boys marching through their downtown area last year, and they're attempting to ban another protest where masked Proud Boys are parading around. The problem is they completely base their statute on the Glens Falls statute, which was challenged by other MAGA adjacent activity people a couple of years ago, and the Northern District of New York Federal Court struck down that statute. So we're not quite sure why Ballston Spa went with a statute that's already been found to be unconstitutional, but there it is. So we're not aware that anything has, they've enforced it as of yet, but we're watching it. Nassau County has taken a different tack. They have enacted a mask ban that they claim contains a religious exemption as well as a health exemption. But when you look at the health exemption, it relates only to people who are wearing a mask to protect their own health. So if, for example, you live in a multi-generational family setup and your mother or grandmother has some sort of, illness that make them particularly susceptible to COVID, or as we come into pneumonia and RSV season, the winter season of respiratory illnesses that take down a lot of older people, you wearing that mask to protect your family members, you would not be entitled to that exemption.
So it's clear that the Civil Liberties Union is, of course, against the mask ban. So what will the union be doing to potentially roll back the bans and or stop other counties from following suit?
We know at the end of last session, a few bills were introduced in order to, quote, reinstate a mask ban in New York State. We're obviously watching to see what happens there. We're part of a very large coalition of people, whether it's public health people, whether it's, free speech, First Amendment folks, privacy tech people, HIV/AIDS folks who've been targeted before, LGBTQ groups that have been targeted before, trying to engage with and watch what will happen in Albany, because it's been very unclear as to whether those bills will move this session. There was a lot of discussion around congestion pricing and whether Albany would come back into session. So we're expecting that either a mask ban of some sort will be introduced as part of the budget process, or it will come across everybody's table as part of the ordinary course of the session.
Would you say awareness is an issue? Like, do you think New Yorkers understand the gravity and the history of the mask ban in the state?
I think people are coming to understand that. I do think people in Nassau County have gotten very familiar very quickly with what all of the issues are. I think people in the various impacted communities already understand, which is why when this ban was considered first at the end of July, I mean, it was literally within a week. They considered it on the 29th of July. It went to from the Public Safety Committee to the full legislature, and then by the 15th, Blakeman had signed it into effect.
Right.
From July, and to the point that it was actually signed, there was an awful lot of, sort of pre-signing coalition work being done. People had started to activate public health, LGBT, HIV community, privacy tech people back in June, when there was, the big hoo-ha with, I think it was the ADL maybe, and another sort of national organization came to New York and had a really splashy press conference up at Columbia University about unmask the hate. But in Nassau, as soon as they started talking about it, people came together. So I think there's already a fair amount of folks who understand the ramifications here and what all of the collateral consequences are. We're trying to make sure people are educated. We have a Know Your Rights. We have an FAQ on our website. And again, as I say, we're trying to put together some sign-on letters to go up to the legislators in Albany. Public education, I think, is really important. But again, this is a third rail, masks. Do you ban them? Do you wear them? Do you mandate them?
And from your purview, is there anything that the state could or should be doing to stop these different county legislators from implementing the mask bans or even help to guide them?
Well, that's the problem. I think the New York State Department of State is sort of counsel to locales, to counties, to local towns and cities. They issue guidance materials. For example, they have a whole memo on political signs and what kind of zoning ordinances you can enact as a locale to, control proliferation of signs, visual clutter, potential, traffic hazards and the like. They could issue, I think, a memo, a guidance document to locales around the state. They could say you're preempted, you can't do this. I don't know that there's a way to actually pass a piece of legislation that gives a locale and a police department the right to enforce a mask ban, because it does require engagement. So you have Fourth Amendment issues about searches, seizures, traffic stops, stop and frisk. You have disability issues because if you have a medical exemption, it requires some interrogation. And under disability law, no one with a disability, whether it's apparent or invisible, is obligated to disclose unless they're seeking an accommodation for something. I can't get into this shop. I need to be able to have a ramp, something like that. But police to interrogate, it's inappropriate. Same thing for religious exemption. you cannot permit the police to interrogate somebody about their religious practices. So how do you go about crafting this? The state version of the law, which we understand is probably going to be amended, indicated that there's a health exemption only during a declared state of public emergency, which is why I sort of focus on Hochul with triple E. I don't think we're ever going to have a declared state of emergency because it was so controversial and divisive.
Yeah, right.
So
And
there's no exemption, right, in the state law as it was written. So
well, certainly a lot to look forward to, but we thank you so much for taking the time to speak with us today, Beth.
great. Thank you for having me on, and hopefully we'll talk again when we have more to discuss on this.
And we were speaking with Beth Haroules, a senior staff attorney with the New York Civil Liberties Union. And for more information on the county-led mass bans and for exclusive content, you can subscribe to our newsletter at newsletter.nynow.org or by scanning the QR code on your screen. Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,